Hi there, my name's Eric. I'm a registered nurse, and you can be one too. But first, you've got to pass the Nclex. So I'm here today to give you some hints and tips about successfully passing the Nclex, which I think you'll find very beneficial. It's a little workshop I like to call Nclex Pqrst. The P stands for pause. All right, I want you to take a moment and realize how far you've actually come, that this is the next hurdle you've got to challenge yourself with, passing this Nclex test. You should be really proud of yourself. I'm sure your family and friends are proud of you. And so just take a moment, pause, and think about where you're at. It's time to de-stress, okay? The Q stands for questions. The Nclex is a big collection of questions that you're going to be asked regarding your nursing knowledge. So you're going to have to start getting practice in answering questions from this point on. I suggest to you to get onto websites or open up your book and start answering Nclex style questions. Next is R. R stands for read. I'm not talking about reading more nursing books. I'm talking about read about the Nclex test. Get on websites or see the brochures that you've been handed before and understand what the Nclex is about. You're getting closer and closer to taking it, so read about where your testing location is, read about what topics will be covered on the Nclex. Just read and understand, and what I like to call know the beast. Know what you're setting yourself up to take, so you don't have any weird lingering questions about the Nclex test in particular. The next letter is S. S is for study. You're about to take a huge test, so you need to study for that test. There are multiple avenues and techniques that you can use to study, whether it's pictograms, flashcards, an app on your phone, reading the book, quizzing your friends. Multiple choices are out there, and you need to find which one works with your brain the best, okay? Your learning techniques are different than your friends and different than your parents, so find out what works for you and is enjoyable, and to study and study and study, okay? The T stands for time. Now is the time to start studying for the Nclex test. You're already watching this video trying to get hints and tips, and I'm telling you, use that motivation and start applying it towards the Nclex. Review those questions, start studying in your own way, read about the Nclex test. Now is the time to do that. In summary, for the Nclex Pqrst, P, pause, and just remember you've made it really far. Congratulations to you, okay? Don't stress yourself out, because this is just one next hurdle, and then you're a registered RN. Q is for questions. Do questions. Start with doing as many questions as you can per day and add to that. Start with 10, then maybe next day to 11, 12, until you're taking many, many questions each day in preparation for the Nclex. R is to read and review about the Nclex test. Know where your testing location is. Know what topics are going to be covered on the Nclex. Know where you need to go and what you need to study. And that brings us to the S. S is for study. Study, study, study. Whatever way of studying works best for you, if it's flashcards or reading or quizzing friends, whatever it is, and you find enjoyable, latch onto that and do a bunch of that, because that's going to make your time worthwhile. And the T is for time. You're watching this video, now is the time to start studying. Now is the time to get prepped and get ready for the Nclex. I encourage you to ask any questions that you might have. Thank you for watching this video, and good luck to you on your test.